Hello guys, today we will quickly recap about the lymph node stations around the stomach. Starting with this diagram, you can see this is the first lymph node. This first lymph node is the right paracardiac lymph node. Second lymph node is the left paracardiac lymph node. Third lymph node is along the lesser curvature of the stomach. Fourth lymph node is divided into three: first, second, and third. The 4SA is along the short gastric artery. The 4SB is along the left gastroepiploic artery, and 4D is along the right gastroepiploic artery. Then the fifth lymph node is suprapyloric lymph node, and sixth one is the infrapyloric lymph node. So these lymph nodes from 1 to 6 marked in yellow color are known as perigastric lymph nodes. Then from the seventh lymph node, the number 7 is along the left gastric artery, and 8th one is along the common hepatic artery. The 8th lymph node can be divided into 8A and 8P. 8A is the anterosuperior lymph node along the common hepatic artery. 8P is the posterior lymph node along the common hepatic artery. Ninth one is along the celiac axis. The 10th one is in the splenic hilum. Remember this, most of the time asked. And 11th lymph node is divided into 11P and 11D. P for proximal and D for distal. That is, 11P is proximal to splenic artery, proximal part of the splenic artery, and 11D is the distal part of the splenic artery. Then 12th one is along the hepatoduodenal ligament. This 12th one is along the hepatoduodenal ligament. The 12th one can be divided into three parts: 12A, 12P, and 12B. The 12A hepatoduodenal ligament lymph node along the proper hepatic artery, A for artery. Then 12B hepaticoduodenal ligament lymph node along the bile duct, B for bile duct, and P for portal vein. So 12th one is along the hepaticoduodenal ligament, A is for the artery, P is for the portal vein, and B is for the bile duct. 13 is the lymph node along the posterior surface of the pancreatic head. 13th one is the lymph node along the posterior surface of the pancreatic head. And 14V is along the superior mesenteric vein. 15 is along the middle colic vein, and 16 is the para-aortic lymph nodes. And remember, in D1 gastrectomy, we remove from station 1 lymph node up to the station 7 lymph node is known as D1 gastrectomy. In D2 gastrectomy, we remove D1 lymph nodes plus 8th lymph node, 9th lymph node, 11P, 11D. We do and 12A. We do not remove the number 10 lymph node in D2 gastrectomy because it is very close to the splenic hilum and we can injure major vessels. Therefore, D2 gastrectomy, 10th